item is report of the Finance Committee and Chief Finance Officer, Clark Phillip.
Thank you, Rick. I'll be brief with the review of the Finance Committee agenda meeting. We reviewed the comparative balance sheet for April 30th, noting that cash had increased by about $1.3 million over the year. Total assets is about the same from the year to the end of April. Liabilities have gone up about $4 million, and fund balance has decreased about $4 million. The cash statement of cash flows under the indirect method gives you some more detail on why the cash increased by $1.3 million. Looking at the current ratio for the entire entity, the current ratio dropped slightly from March to April because the current assets went up $3.5 million while the current liabilities went up $4.6 million. The defensive interval, which is the cash per day that we have to operate with, that has gone up because of the increase in cash of about $12 million during the month of April. Moving on to the income statement, I will summarize that just briefly. The operating revenue is behind budget by about $11 million, but that is offset by administrative and service expenses, which are ahead of budget by about $19 million. 12.6 of the favorable expense variance occurs in the Medicaid program, and 6.4 of the favorable expense variance occurs in the non-Medicaid program. Overall, the operating surplus or deficit, we have about a $1.3 million operating deficit in the Medicaid program. Year-to-date, a $7.4 million deficit in the non-Medicaid program, totaling $8.6 million for the entity. If you add in, now that is about 7.7, almost $8 million better than what was budgeted. We had budgeted to lose about $16.3 million year-to-date through the month of April. If you add in the impact of the risk revenue, which we have not recognized yet, that's about $5.5 million. So our Medicaid deficit goes from a deficit of $1.2 million to a surplus of about $4.2 million, and the entity moves from a deficit of $8.6 million to a deficit of $3.1 million. Looking at the medical loss ratio, the medical loss ratio has continued to creep up a little bit. Our service medical loss ratio is about 86.4%, which is pretty good relative to other entities that I've seen. They do allow you to add healthcare quality improvement activities to this to make sure to allow you to exceed the threshold of 85%. Our activities account for about 4.4%, which brings our total medical loss ratio to 90.8% for the year. We reviewed some of the PM variances, the largest favorable PM variance being in the community care facilities, $1.23 PM. Overall, we have in our Medicaid, we have favorable variance of 60 cents PM. In innovation services, about $2.62 PM, and B3 was a small unfavorable variance of about 30 cents, for total overall positive variance PM of about $2.93. Any questions on the financial statements? If not, we'll move on to the budget revision number 8. I'm sorry,
We need a motion for approval of the financial reports. Is there a motion?
So moved.
Is there a second?
Second.
Okay, we have a motion and a second. All in favor say aye.
Aye.
Any opposed? Okay, it's unanimous. All right.
And the budget revision number 8, which pertains to the current fiscal year that we're in, fiscal year 2018. There's a small budget revision worth about $182,000 in debt. $300,000 of that relates to an increase in the three-way contracts, the funds and expenses, and the administration is a reduction of $184,000.
Versus board, is there a motion?
Motion to approve the budget revision.
Is there a second?
Second.
All in favor of the motion, say aye.
Aye.
Any opposed? It's unanimous. Okay, sorry.
Okay. We presented the budget at the Finance Committee meeting in May. Some of you attended that. Just very briefly, there were some challenges that we faced in developing the budget that had to do with the rates. The rates were an increase of about 1.1%. Overall, there was a service increase of about 1.9%. The state reduced our administrative budget by about 0.8%. Biggest challenges around that and the items that Brian and I were discussing with the state, trying to get them to change the position on were around Vaya Total Care, intergovernmental transfers, and administrative expenses. For the single stream programs, they do not allow those for administrative expenses when they're calculating our rates. And the sum total of those is about $10 million. So there's $10 million of administrative expenses that they don't pay us for, essentially, in our rates. So that was those were the challenges around the rates. The budget, just to briefly re-summarize the budget, we're anticipating about $357 million in service revenue, approximately $37 million in administrative revenue, bringing us to just under $400 million at $395 million, essentially. We expect to expend service expense to around $361 million. Administrative expenses will be about $48 million. That brings us to a operating deficit of about $13.5 million before the Medicaid risk revenue is added in. Once you add in the Medicaid risk revenue of about $6.8 million, that leaves us with a total deficit of about $6.7 million. Now then, we want to talk about the budget amendment at this point, or we need to pass the ordinance on the budget first. But there are some actions taken in the state budget that will improve our budget situation slightly.
I'm going to go ahead and consider the budget first.
Okay.
To approve budget revision number 8.
Yes.
Yes.
Is there a motion to approve the state, our budget for 1819?
Our budget ordinance.
Budget ordinance.
So moved.
We have a motion. Is there a second?
Second.
Any more discussion? All in favor of the motion to approve our budget ordinance, say aye.
Aye.
Opposed?
Aye.
Next, budget revision number 1.
Okay, as Brian talked earlier, in the State Appropriations Act, for the coming year, they actually increased our revenue by decreasing our single stream cut by $3.1 million. We also had an increase in the intergovernmental transfers, which took away some of that money. We had to add a couple of positions relative to all of the county issues that are going on and going forward. And so the net effect of the budget amendment month 1 is to reduce the fund balance needed to balance the budget by about $2.8 million.
Any questions? Is there a motion to approve budget revision number 1 for our upcoming 1819?
I make the motion.
Second.
Second.
Motion and a second. Any discussion? All in favor of the motion, say aye.
Aye.
Any opposed?
Aye.
Okay, it's unanimous. Thank you.
I would like to, in the future, see more of a breakdown of who's getting the grants.
We, just as a process of the budget, when we build the initial budget, there are a lot of non-recurring allocations that we get from the state. We do not include any of those in the budget because they're non-recurring, and we don't know that we will get those. Throughout the year, as we get those non-recurring allocations, we will add those to the budget, and those are the budget revisions that you will see during the coming year.
But I mean, don't we fund out of our budget nonprofits? Don't they come to us for grants?
Not necessarily if we think of them as grants.
Okay.
I think we think of them, those are contractual agreements that we have with providers who are providing specific services we deemed as needed for the network.
Okay. Our regulatory compliance and quality committee report, call
Don't
Bill
have,
Kennedy.
don't have the budget revision. Did we wait? Did
We
vote
did
on
the one.
that?
Yeah, we got that.
Yes, we did.
Yeah,
Both of them.
we got it, yeah.
Well, we've moved our, extended our time for our meeting to 2 hours because it takes 2 hours to go through, and we were 1 hour and 55 minutes today, so, and we didn't dilly-dally. So we went through the monthly reports. We're doing really good on our transition to community living. Our core performance measures and compliance log, we're doing good. Our echo survey came out very good. There's on our phone answering time, we went up a second, but we're still well below. We're at 8 seconds instead of below the 30-second answering thing, and that's partly because there's some people working remote doing answering the call line. We went over our annual compliance plan, our quality management annual plan with the quality management evaluation, quality management program description, and quality management work plan. We went over all the surveys, one by the 2017 Provider Satisfaction Survey, 2017 ECHO Survey Outcome, 2017 Perception of Care Survey highlights the 2016-17 National Core Indicators. So a lot of those had to be 6 months behind so we can get the accurate data to look at those. So we do have a delay on some of these, but all in all, we're doing really well. And we do need to have motions on, I've got to get to the annual compliance plan. I need a motion in a second to approve that. Same thing with the quality management annual report.
Okay. Okay, first thing we'll consider is the annual compliance program plan.
Make a motion that the full board approve the plan as presented.
Second.
Okay, we have a motion and a second. All in favor say aye.
Aye.
Opposed? Okay, it's unanimous. Okay, next would be approval of the annual quality management annual report.
I move that we approve the report that was presented to our committee with some suggestions for changes.
Okay, we have a motion, is there a second?
I'll second.
All right, we have a second.
And for discussion, what revisions are part of your motion?
There were one graph at the, was,
There was one graph that they asked us to get clarity on because it wasn't apparent from the graph whether there might be a mathematical error. They asked for improvements in only improvement activity related to credentialing.
and then striking one word.
Striking one word.
New.
All right. There's a motion and a second. All in favor say aye.
Aye.
Any opposed? All right, it's unanimous.
And I just want to
Thank you.
commend our quality committee, and they're doing a great job. And any of you want to see the projects and the solutions they've come up with and how they're working to make everything work better at Vaya, I'm impressed. And of course, there's some things that we went down on a little bit, but mostly we're at the top as the MCO comparison. You look really good, especially sometimes compared to part of
Thank you, Bill.
But thank you.
Okay, our Consumer and Family Advisory Committee report. Call on Pat McGinnis.
Thank you. Again, I'd like to thank you, Rick, for going to Raleigh with us. We held our annual business meeting and steering committee meeting on June the 8th. Our primary purpose is to allow CFAX to fulfill its statutory requirement to review and comment on Vaya's proposed budget. We were also guided by our Chief Financial Officer, Clark, and we inquired about risk reserve and under what circumstances it would be assessed, as well as single-stream funding reductions and residential and IDD services. Brian Ingram and Christina delivered an update on Medicaid transformation and House Bill 403 and Rutherford County's proposed disengagement. DHHS's Consumer Engagement Empowerment Team facilitated a strengths, weaknesses, opportunities, and challenges related to CFAC fulfilling its statutory requirements. And we had Russ Ryder here from the coast, and Suzanne Thompson came for the afternoon session. Wes had been our assigned partner for a while, but he's going to another area again, and we're getting Stacy back. CFAC elected to sponsor Vaya's purchase of the film Suicide, The Ripple Effect, to show throughout the catchment area. This film will be accompanied by a messaging discussion as well as information about community resources related to suicide prevention and related to the needs. Our steering committee is planning a retreat for October, and more details will be about that as they're available. And we're expecting maybe to invite some of the folks we talked to in Raleigh and other places to come. Right now we'll have a little bit of trouble. We always have that in October, and lodging is at a premium in October as far as rates. So we are right now being surveyed pretty much on whether we might want to switch it to a Thursday and Friday rather than a Friday and Saturday. So that's what we are to see that.
Thank you, Pat. Okay, our provider advisory council report, Paul and Jeannie Duncan.
Let me see if I can read my pen scratch here. And again, one of the reports from the QA, if you didn't hear it, really say, the provider advisory council scored the highest in the state.
Thank you, I appreciate you throwing that in. I'm trying to get 2 hours of data into my 5 minutes. People are pretty tired, but yes, please speak up and recognize that, yes.
I know I keep reporting that every month, but just in case.
I think I handed them down.
Yeah, catch that.
And please, speak up, yes. I'd love anybody on the committee to add some of our accomplishments.
We have, I think the group has worked really hard to make the meetings meaningful. We continue to work on goals and objectives that have Vaya's requests. And met with us before and during our retreat, and we set some of those goals. So a couple things and they change over the years, priorities shift, but one of the things the mental health and substance use subcommittees are working on, of course, are the goals from the Western Alliance Substance Use. There you go, Alliance. So, and we actually had quite a few things that were assigned to the PAC to do in there, and then they've come up with some things on their own. So, part of what we're trying to do there is to develop some of the tools and then refer those back to the subcommittees within the Alliance that are actually working on communication and those sort of things. So they continue to work on those. With IDD, we've been working pretty closely with Vaya on a couple initiatives with attestation, self-audits, with the supported living initiative that Jesse is sort of spearheading. This last month we had a presentation from Simply Home, who is a provider of technology actually they're in Arden, I guess is where their office is, and they do a lot of just lots of different kinds of technology to help people live on their own who have disabilities and so she did a really good presentation, had a lot of questions about that. In IDD, we've also tried to work really hard on integrated care because a lot of the IDD providers aren't sure how that applies to them. It's pretty obvious with behavioral health and substance use providers, but the IDD providers. And then one of the super measures that Vaya has is meeting the primary care visit within the last 12 months for those folks on innovations waiver. So we're encouraging all of the IDD providers to be sure, even if they're not a residential provider, to be sure that if they're providing any services to an innovation waiver or otherwise, that they're gathering that information from the parent or care coordinator or within their have it within their own records as well. And we did have a change to our bylaws this year. This last month, the bylaws had originally stated that the officers would serve one term, and I think I mentioned last time we met that I was not legal because I was past my year, so they changed the bylaws to be 2 years.
Lucky you.
Was it 2 years? But you could serve.
Sounds familiar.
I was an illegitimate president, was what I said. And so they can also serve 2 consecutive terms before they have to rotate off of the out of the roles of the officers. So we do still need to continue to do some work on the regional collaboratives. And so that's one of our ad hoc committees that we'll be setting up as well. Our retreat is in September, which we're not meeting in July, so September, God, this is just around the corner, isn't it? So, and just one last quick thing. The PAC did submit comments to Rutherford County Commissioners. It was a fine line of walking, considering providers in this area also provide services and partners. And what I tried to do as their president was take their comments and concerns and what they wanted to say and put those in a letter, and we did submit that. And the 3 basic, and you can probably see it on the website. Theirs. I've been told it's there, but we did say that we talked about providers' experience in other parts of the state, the disruption that disengagement causes, and we cautioned them to do their due diligence to make sure that the decision they made was the absolute best decision they could make for the consumers and the families that are in the Rutherford County area, and that they do everything in their power to avoid any disruption in services as they did their due diligence, or if their final outcome was to disengage, that they really take all of that into consideration. So we were trying to, we wanted to be as supportive as we possibly could without, without stepping on toes of people. And I think by, all the providers on the provider council like the relationship we have with Vaya, and wanted to be as supportive as we could without potentially causing problems. That's on there if anybody wants to read it.
Thank you, Judy. All right, we have a few items under other business.
Thanks, you. I've handed out 4 resolutions for you all. These are really housekeeping is probably the best way to describe them. The first is a resolution to approve engagement in electronic payments. This is actually resulting from the Local Government Commission approved new rules for electronic transactions. This has always been an issue with the pre-audit requirement of the Local Government Budget and Fiscal Control Act. The pre-audit requirement has no financial minimum, so everything has to be pre-audited, even if Brooklyn goes and buys a gallon of tea for the board, that has to be pre-audited. So it costs $2.50, but it's still got to be pre-audited. I think the UNC School of Government has a blog, the Codes Canon blog, for those of you who are not familiar, that kind of just tells you everything you need to know. They keep track of it so that we don't have to, and they posted something in March kind of summarizing what the new rule said and pointing out that effectively the old rule made it impossible. It was impossible to comply with. You could not pre-audit every electronic transaction, particularly transactions made via credit card. So the new rules allow some more flexibility, and the first step in that is a resolution of your governing board to approve the development and adoption of a written policy that will outline procedures for pre-auditing obligations as required by these new rules, and to approve our engagement in electronic payments. So that is the first resolution that I'd be asking you all to
I have a question. How's this going to affect CFAC members that don't want them? Is this going to affect CFAC at all?
Not at all.
I have a question also. Typically, the boards I've been on have approved policies and resolutions, but this is a resolution to basically direct you all to do a policy,
Correct.
but not approval of the actual policy.
Correct.
Does that still meet the letter of the law?
Yes, it
And
does.
we're not approving the policy, we're just doing a resolution to tell you to do a policy?
Yes.
Okay. I'd make the motion to approve this resolution.
Okay. We have a motion and a second. Any other questions or discussion? All in favor say aye.
Aye.
Any opposed? Okay. Yes.
The second resolution is, you all will recognize this because you've done one of these before. This is the sole source exception to the bidding laws for the purchase of Narcan. As you know, the bidding laws require us to bid out purchases of goods in excess of $30,000. But this is the Adapt Pharma is the only supplier of Narcan. We've received another allocation from the state, and so we're just asking for your support of the sole source exception to purchase Narcan.
Motion to approve.
Okay, we have a motion. Is there a second?
Second.
Any discussion? All in favor of the motion say aye.
Aye.
Any opposed?
The third is like literally housekeeping. This is a motion for the board to approve our facilities department to dispose of surplus property by donating it to a nonprofit if we determine that that's the appropriate way to get rid of it. This would be things like used desks, used chairs. What the motion says is that you delegate to us to determine whether any property is surplus, obsolete, or unused, and to donate surplus property to nonprofit entities if we post a public notice and wait 5 days before donating the surplus property. We've had requests from providers for some of our surplus property, and we want to be careful that we're not engaging in favoritism or anything like that, and so we would just like you to approve this process for donating.
I do have a question on that
Yes.
one. There is no value cap on this, so theoretically, you could give anything that they thought was surplus or unused. Because at the county level, everything has to go on gov deals, and then if it is not saleable on gov deals, and the value is below a certain level, it can be donated.
There's nothing, so one of the challenges is that, and we're really trying to do this out of an abundance of caution, there's no specific statute for LME MCOs about surplus property. There's statutes for cities and there's statutes for counties, and there's nothing specific to us. If you all would like us to put a financial maximum in the resolution, we can certainly do that. Our goal here was really, and I don't know, Robert, if you might be able to address this better.
Yeah, I think we run into the same challenges as everything has to go on gov deals. And typically the cost recouped from selling on gov deals certainly doesn't cover the administrative cost to put it on gov deals. Typically also there is with certain types of equipment, we do have access to the state surplus facility. So we can take stuff into Raleigh and deliver it to the state surplus. That's another way that we can get rid of property that we see as no value. But in order to do that, you have to inventory it, then we have to submit to them. They send us a bunch of stickers and labels, and we have to label everything, and then we have to show up at the exact moment of time that they designate for us to show up. And so it's a very strict process, and so some of these things, we see this a lot in our reduction of locations, and as furniture becomes obsolete in different locations. Just being able to donate that is a sort of a hassle-free way of not having to go through these administrative overhead sort of burdens and processes to follow.
Does this include
But I agree,
vehicles?
if you want to put a maximum value on that, certainly no issue with that. I mean, most of what we donate is considered to be little to no value.
The difficulty though with putting a value on something is you have a desk in Hutch that was, $3,000 when you bought it. It's been used for 10 years. Who's going to determine what that value is anyway?
$50.
My understanding is that
I understand what Ira's saying, I think they do.
Yeah.
But at the same time, how do you are we going to have a delegated person that, says this desk is worth?
Yeah,
I wonder at some level if you just add that you'll report out to the board what you donate once a year, so that the board is able to at least see 20 desks, 50 chairs, whatever that is.
At least we're not giving back.
It being a county commissioner, we can't do this, so that's why I'm a little leery of it. But if we do something that works for everybody, that,
You can show what you show what you're donating, and there's a way to question or ask questions about that if you want to choose.
It is different in a second way to county commissioners in that when I was a commissioner, you got a list of what you were going to donate as opposed to delegating it to staff to do. The wording here was as needed and ongoing. So I understand Billy's concern.
We got a list every time they give away cars and other things that were bigger than others.
Yeah, we would not do that. We would not give away a car. Certainly
Well,
those.
some of them are pretty worthless.
Yeah, some of them are, but I mean, anything of value like that, or large servers, or, large computer systems, those kind of things, certainly bring a higher dollar value, and certainly would like to see those recycled in some way, so we do utilize GovDeals to be able to do some of those larger, more valuable pieces of property.
so there's kind of already a value set for what goes to GovDeals and what not because of the administrative cost.
Yeah, what we need to look at is what's the perceived value, and for us, most of the time, furniture has little to no value, because we use it till it's pretty, it's not worth really putting back in service.
Right.
And computer equipment's a little bit different, but still, we use it till, it's well past the, and computer equipment's a little bit different, so that the longer you keep computer equipment, the more you actually have to pay to maintain it.
Yeah,
So there's a sweet spot in there for some of these things.
Let's just ask staff to rework this and bring it back to us. Okay?
Okay.
I'll take your suggestion and your suggestion around the cap. Is that?
Okay.
And maybe who you donate to over the course of the year.
Sure. Okay. Thank you. The last one is another sole source exception. This is for general pharmaceuticals. And this is some combination products, buprenorphine and naloxone combination products. We received an allocation from the division, and there's only one supplier of these as well. So we'd be looking for approval of another sole source exception contract to general.
Motion to approve.
Second.
Okay, we have a motion and a second. Any discussion, questions? If not, all in favor say aye. Aye. You opposed? Aye. Thank you.
Thank you. 3 out of 4 is not bad.
Any other business?
On that first process, do we have any legal obligation if we donate it to a vendor to report that as I don't know what kind of transaction that would be.
I don't know.
County-wise, but do you know what I'm trying to say?
I'll see what I can find out. The challenge for us is, again, there's really specific statutes for cities and counties around all of this and around bidding, and the statutes aren't clear that they apply to us, and so we're trying to operate within them even though it's not clear that they apply to us.
And part of the reason I ask is because I could see, let's say it's maybe an office of 3 therapists that are private, and they complain that the nonprofit's office with the same number of employees is getting an advantage from us.
That's why we put in here that it would be posted in 5 days, because I don't want to get into a situation where giving it to one provider over another or anything like that.
Is there a motion to adjourn?
Well, I just want to say I'll try to hit the highlights better on the next policy
That's all right.
committee report. There's some really good highlights in running the meeting and trying to write them down too, so I'll try to do better on that, but I'm going to adjourn.
Is there a second? Okay, all in favor say aye.
Aye.
Thank you, everyone.